Now, in her State of the Union address last September, European Commission President Ursula von der Leyen called on Europe to build a European health union. 1 year later, and on the eve of her next State of the Union speech, the Commission is unveiling its proposal for a new health agency. Its main goal is to help the EU better respond to emergencies after the COVID-19 pandemic demonstrated the dire need to strengthen cooperation between EU states. Well, for more on this new European Health Agency, we can cross to Brussels and speak to our correspondent there, Dave Keating. Dave, remind us what went wrong in 2020 and why does the EU need this agency?
Well, in the early weeks of the pandemic response in 2020, the EU had a really disjointed and chaotic response. And that's partly because healthcare is not an EU competence. It's something that's dealt by individual countries. So what we saw in those initial weeks was this haphazard closing of borders between EU member states. And we saw a rush to get medical equipment where each EU country was bidding to get medical equipment, and we ended up with countries like Germany that didn't really need it yet having a lot, and Italy, which desperately needed it, having a little. Everyone could see that individual, every man for himself approach didn't work. And so ever since then, they've been trying to figure out ways that the EU can better cooperate on this type of thing. So later in 2020, when the vaccines were being developed, all of the EU countries decided to band together and have the Commission do joint purchasing for vaccines. And this was the first time the Commission had ever done anything like this. There was a lot of criticism about the contracts that the Commission made in this, its first exercise in such an endeavor. And there were a lot of comparisons made to the contracts negotiated by other countries, most especially the US and the UK, which had contracts which gave them guaranteed access to all the doses made on their territory. Those countries turned into basically competitors in the early weeks of vaccination. And because the EU didn't have any kind of such clauses in its contracts, about half of all the doses made in the EU were actually leaving the bloc while there were supply problems, and meanwhile the US and the UK were keeping all the doses there. Europeans were also looking enviously to the United States for their very fast funding program for developing vaccines, the program there that was put in place by Donald Trump, Operation Warp Speed. Now, the EU did have a lot of individual countries financing vaccine development. Don't forget, of course, BioNTech is a German company, the company that developed the Pfizer vaccine, as we call it here in Europe. It's called the BioNTech vaccine elsewhere in the world. But that funding was also haphazard and disjointed and wasn't coordinated in the most effective way, especially given that the EU is a pharmaceutical superpower. So what's being proposed today by the European Commission is something called HERA, the Health Emergency Preparedness and Response Agency. That would be the EU equivalent to the US Biomedical Advanced Research and Development Authority, BARDA. That agency in the US gives the US federal government the power to rapidly push money into things like vaccine development when there's a health emergency. And the Commission says that the EU needs Brussels to have similar powers as Washington in such an emergency response. The key is going to be how individual countries respond to this, because of course this proposal will need the approval of the European Parliament and all 27, not all, a majority of 27 national governments. And traditionally, national capitals guard their power very, very fiercely before handing it over to Brussels.
Dave, this agency, HERA, is just one of the proposals to expand the EU's health competencies. What else has been proposed?
Yeah, this is part of a whole package of giving the EU more health powers, and a lot of the proposals have already come out. For instance, expanding the authority of the European Medicines Agency, which approves vaccines, and also giving the Commission the power to declare a pandemic emergency even if the World Health Organization hasn't yet. People say that would have given the EU more power to act in a coordinated way earlier on in the pandemic when the WHO the WHO was being very reticent about declaring that emergency. So those proposals are already in the legislative process. In fact, the European Parliament will vote on some of those proposals this week in Strasbourg. And again, this is part of this whole concept that the EU needs to change in the way it approaches health. I mean, up until 2020, the fact that healthcare wasn't an EU competence never really caused a major problem. Of course, though, in a pandemic, you can see just how cross-border health problems are. And so I think the pandemic experience has caused a wholesale relook at what kind of powers Europeans want the EU to have when it comes to health. But of course, individual national capitals, as I said, always fiercely guard their competences in this area. And I've had conversations with national government representatives in the Council here in Brussels, and they'll tell you candidly they know this is the right thing to do, but they are not sure if they can sell it to their national capitals, because almost on principle, the reflex is to resist this type of thing. So we'll see how this works in the Council. I mean, this has to be done fast. The Commission wants all of these proposals approved by the end of the year. And they say, look, another pandemic could be around the corner, or a very dangerous new variant of the existing COVID-19 pandemic. And if the EU is caught flat-footed on this again, and it appears like lessons weren't learned about how to coordinate in this response, by the time we have another pandemic, it would really be unforgivable from the perspective of European citizens. So the clock is ticking. We'll see, especially in the Council, when it comes to national governments, how they're going to respond to this.
We will be following all those proposals as they make their way through the Council. Dave Keating, thank you very much. Dave Keating, our correspondent in Brussels.